Hello, everyone. So, today we are going to talk about amoxicillin versus azithromycin, the ultimate antibiotic showdown. Why it is ultimate antibiotic showdown? Because almost everyone have taken these antibiotics in their lifetime. These are the most commonly used antibiotics. So, suppose you go to a doctor and you are sick and you need an antibiotics. Then comes the big question: amoxicillin or azithromycin, which one stronger, which one works faster, and why your doctor picks one over the other. Today we are settling this medical debate once and for all. Whether you are a future doctor or just someone who hates being sick, this video is for you. So first we'll see their classification. So here we have our amoxicillin, which is a beta lactam. It's a type of penicillin. These are cell wall synthesis inhibitors. Okay, so these cause disruption of the cell wall. Think it like this: amoxicillin pierces the bacteria with a sword and the bacteria bursts open. While our azithromycin is a macrolide, it is a 50S inhibitor. Okay, so these are protein synthesis inhibitors, so they stop the bacteria from growing. They don't kill the bacteria, these are bacteriostatic, you can say. Okay, so which one is better? We'll see now. So first, as we see, amoxicillin, it's a beta lactam antibiotic. It's from a penicillin family. It kills bacteria by inhibiting their cell wall. Okay, so the bacteria burst and die. So they disrupt the bacterial cell membrane. These are broad spectrum antibiotics. These mainly works on gram-positive bacteria like Streptococcus, Staphylococcus, and somewhat in gram-negatives like E. coli and Helicobacter pylori. But mainly it is a gram-positive. So there is a fun fact that amoxicillin is often combined with clavulanate to fight resistant bacteria. Now comes our azithromycin. It is a protein synthesis blocker. It's a bacteriostatic, not bactericidal. So this belongs to a macrolide class of antibiotics. It's kill bacteria by binding to bacterial ribosome. We saw that 50S ribosomes. So these bacteria stop, these antibiotics stop the bacteria from making the proteins. So that's how they stop bacteria from growing. Because there is no protein synthesis happening in bacteria, bacteria is not able to grow. The fun fact is that the azithromycin has a longer period in your body, like it stays longer in your body. And that is why the treatment course is short because it stays longer in your body. So you don't need for a long duration course in azithromycin. So we have a detailed comparison table. Before going for the detailed comparison table, you might have in your childhood, if you remember, especially for 90s babies, they remember taking amoxicillin syrup and it used to come in various flavors. So one of them was strawberry flavored, bubblegum flavored, and so many other flavors of amoxicillin. Okay, so here is the detailed table. Amoxicillin, these belong to penicillin type beta lactams, and azithromycin belong to macrolides. Okay, mechanism of action inhibits cell wall synthesis. Azithromycin inhibits protein synthesis. So here bacteria burst open. Here bacteria just are not able to grow. The spectrum, it is broad, mainly in gram positive, little bit gram negative bacteria. Azithromycin is also gram positive, but these are very very useful in atypical bacteria. So indication mostly ear infections, ENT infections, UTIs, then lower respiratory tract infections, infects cholerae also sometimes these are prescribed. But azithromycin mostly respiratory, skin, some sexually transmitted infections, atypical pneumonias. Mostly the use of azithromycin is in atypical pneumonia. It's very good because they can work on a broad variety of bacteria from gram positive as well as gram negatives, in which amoxicillin is not able to work. Dosing 2 to 3 times a day, here only once a day you need, and short course like maximum 3 days. It is somewhat 7 days. Half life for 1 hour, and it this is where it comes 68 hours half life. So it stays longer in your body because half life is 68 hours. As we see, we can say oral IV, here also oral IV, nausea, diarrhea, rash. Now here comes the part azithromycin QT prolongation, but this is very rare, mostly in people who have already some kind of cardiac abnormalities, and these people are either very old age people, only them you see the QT prolongation. It's not very common. Interaction, can interact with warfarin and allopurinol. Here it can interact with antacid, warfarin, and digoxin. Resistance to beta lactamase producing organisms. So if there are any bacteria which has developed some resistance to beta lactams, it won't work. And azithromycin resistance is seen in very recently. It was very powerful drug, but sometimes we are seeing that some bacteria have developed the resistance to and azithromycin only in the patient who have prolonged use azithromycin. Only in those patients we are seeing that they have developed resistance to azithromycin. Both drugs are very safe in pregnancy. This is very less expensive. This is somewhat expensive, not too much, but somewhat expensive. So we usually say people to avoid amoxicillin if there is a penicillin allergy war, because it is a type of penicillin. And azithromycin can be taken if there is a penicillin allergy. Now we see, here is a comparison. You see amoxicillin is like a hammer and azithromycin is like a sniper, right? It's killing the atypical bacteria and it is killing the very common ones, like the gram positive ones. So head to head battles, who wins? If you have strep throat, people generally use amoxicillin because mostly strep throat is caused by streptococcus bacteria. So amoxicillin is very good, and this is a first line treatment. A short course, 7 to 10 days maximum. Why not azithromycin? As you can see, overuse can lead to resistance in streptococcus. Okay, and amoxicillin is very good in streptococcus, so you don't prescribe azithromycin. In chlamydia, of course, azithromycin because it's STI. Chlamydia is STI, so you take single dose 1 gram azithromycin and you are good to go. So of course, it doesn't cover all like all type of bacteria amoxicillin, so it's not useful in chlamydia. Pneumonia, of course, if you have atypical, you go with azithromycin. If it's a typical type of bacteria, you take amoxicillin or you combine with and you take augmentin. Infection, first choice is amoxicillin because again there is streptococcus mostly involved. So only if you have any resistance to amoxicillin, then you take azithromycin. Or you have any allergy to penicillin, then you take azithromycin. So we see the risks, allergic risk. Amoxicillin people have some types of this risk for developing allergies like rashes and anaphylaxis, but it is very less, 10%. I think it's still a very huge number. I think it's less than 10%. And of course, diarrhea is very common and can develop resistance in Clostridium difficile because it will remove the normal gut flora, so your Clostridium difficile can easily overgrow. So that's why you don't take it as much. Azithromycin, again QT prolongation, arrhythmias, but it is very less chance. It's only in old age, and of course liver issue. It's also very rare but possible. Never demand antibiotics for a cold or flu. They only work on bacteria, not viruses. here because many people take even small infection and they think that okay, I have cold and flu, I'll take antibiotics. It's not. You don't need antibiotics. Okay. Yeah. So here's a meme. When you realize you could have had your own microbial diversity, it's talking about the gut bacteria, but you have taken azithromycin. Azithromycin is very broad and it works in most of the type of bacteria, right? So azithromycin will eliminate, annihilate your gut bacterial diversity. 65, which one should you take? So it depends. Okay, if you have very common infection, which type of bacteria, if you have allergy, penicillin allergy or not, your medical history. So this, so which antibiotic you should, it depends on a lot of things, right? Bottom line, always let your doctor decide. Don't self-prescribe, okay? Ask your doctor, don't self-prescribe, okay? Here, like in coronavirus, people were taking azithromycin. And why it is very important? Because they were very sick people, old age people with heart diseases. They were prescribed azithromycin as like hell. So that's why there's a meme, arrhythmia, QT prolongation. My joke to you. And of course, don't overuse antibiotics because do you want superbugs? Because this is how you get superbugs. Resistance warning, misusing antibiotics creates superbugs. So this is all for today. I hope you learned something, the difference between azithromycin and amoxicillin. Thank you.